When COVID-19 emerged in Canada, governments postponed all kinds of non-COVID procedures and surgeries, things like heart operations, cancer treatment, hip and knee operations, MRI scans, and so forth. We asked every province in Canada for details on how many procedures, surgeries, and consultations with medical specialists that they postpone. After all, postponed procedures come with their own social costs, and those costs need to be considered as we evaluate how governments responded to the pandemic. We investigated this issue because of stories like Jerry Dunham's. The Alberta patient had waited 6 months to have a pacemaker put in for his heart. But when it was his turn for surgery, the hospital told him that it was postponed due to COVID-19. Jerry waited another 2 months, and then sadly he passed away, leaving behind 2 young children. In Ontario, the government conceded that upwards of 35 patients may have died from having their heart operations postponed due to COVID-19. There have been countless other stories in the news about non-urgent surgeries that have been postponed and the effects on patients. SecondStreet.org asked every provincial government in Canada for data on how many surgeries, procedures, and consultations with specialists have been postponed due to COVID-19. 9 provinces told us there have been over 200,000 postponements since COVID emerged. You can see all the government responses on our website. Unfortunately, our total doesn't even include Canada's largest province, Ontario. The Ontario government simply told us they don't know how many procedures and surgeries they've postponed. Fortunately, the Canadian Medical Association Journal has looked into Ontario's situation. They've estimated there have been about 148,000 postponed surgeries in Ontario due to COVID-19. That brings our total to over 350,000 postponements in Canada since COVID-19 emerged. Canada's long waiting lists have gotten even longer, and in many cases, these postponements have contributed to even more patient suffering. One thing governments could do to reduce our long waiting lists would be to keep our public healthcare system, but allow private clinics to offer the same service. This would help take some of the pressure off of the public healthcare system and reduce waiting times. I'm Colin Craig from SecondStreet.org. If you think this type of research is important, then please consider following us on social media, signing up for our email updates, and consider making a donation. Thanks for watching.